Okay, good afternoon, and welcome to this organization of the Private Sector in Health Thematic Working Group. My name is Felix Awar, and I will be chairing this session. I'm going to give this just about 30 more seconds, and then we will start. Okay, ladies and gentlemen, again, welcome to this organized session led by the Private Sector in Health Thematic Working Group. And we'll be talking about developing a private sector research agenda, how research can contribute to meaningful engagement with the private sector towards universal health coverage. My name is Felix Awar. Again, I'm from Makerere University, the College of Health Sciences, and we're based in Uganda. And my colleague Priya Balasubramaniam from the Public Health Foundation of India will also present us shortly. In terms of the session outline, I will present the introduction and background to the thematic working group and the research activities that we've undertaken. And then my colleague will present on results from the mutual learning series that we've had over the last 1 year in 2020, focusing on managing new kinds of health partnerships triggered by COVID-19, but also beyond. Then I will present results from a survey we undertook with TWG members on priority research questions around working with the private sector for universal health coverage. And we will have an invited discussion from 3 members of our thematic working group and a general discussion. Now on the discussion board, you will have a where you can write your the Q&A board. So if you actually have questions to ask any presenter, please type them in the Q&A. And if you have anything more to comment on, you can put it in the discussion forum. And we will try to monitor these as closely as possible and get back to you and all your comments. Now, all questions will be asked in the Q&A forum because only panelists are allowed to speak on the webinar, but we will answer all questions, and we encourage you to be as interactive as possible. Okay, so we'll start the presentation with who we are. The Private Sector in Health Thematic Working Group is one of the working groups of the Health Systems Global Network. And we are a network of health systems researchers focused on the private sector in health, contributing to new thinking about the performance of mixed health systems, and particularly focusing also on building new partnerships for research and learning. And every 2 years, we get together at this Health Systems Research Conference to share our work and meet with colleagues. that the private sector thematic working group leadership and facilitators are shown on the screen. The first column, led by Priya, Jerry, Phyllis, Meenakshi, and Cicely, have over the last almost 3 to 4 years led the coordinating activities for the thematic working group. And then the next column, most of the people there, Mustafa, Desta, Barbara, have really supported work in relation to the thematic, the mutual learning series that we held over the last 1 year that's focusing around COVID-19. In terms of health communications, Karine Gatelier has led our communication work and a support team. And over the last 1 year, has had a lot of help from the other people on the screen, particularly around the mutual learning series. So why are we interested in developing a private sector research agenda? For various reasons, particularly that governments are becoming increasingly aware of the importance of private sector actors. And indeed, the private health providers provide more or about half of the healthcare provision in most low and middle income settings. So with this high utilization of the private health sector for caregiving or healthcare receiving, there is a great interest now in understanding approaches for including private providers in existing strategies to expand access to safe, effective, and affordable healthcare. And particularly for the research interest, as countries are increasingly engage with private health sector, a learning environment is important. To encourage good practices and discourage bad or harmful practices. Because with the private sector, a lot of issues come up while it's providing healthcare to about half of people. There's issues around governance, regulation, incentives, and really how to align these to ensure good health outcomes. So the aim of our work in this private sector research method is to contribute to development of an agenda for research that supports learning in engagement with the private sector. And in terms of the methods here, we will present a draft agenda, thematic research areas, and some research questions that draw on consultations that our thematic working group has carried out with government officials within itself, with the private sector and other stakeholders. And we also draw from a survey of TWG members regarding ongoing research and really future priorities for research in this area. So next, we're going to present the mutual learning series of online workshops that we've held, about 6 network meetings on managing new kinds of health partnerships during COVID-19 and beyond. I would like to check Priya. Has Priya joined us for this session, this part? Priya, are you here already? No. Okay. So I am going to have to present on behalf of Priya as well this part on the mutual learning series. And people that were involved are also here on our panel, and I will expect your at least engagement in the discussion in relation to these the mutual learning series. So we held 6 workshops, really. Priya, I'm about to take your presentation, Priya. Can you hear me, Priya? I see you've logged in.
Yes, I can. I can, Phyllis. Thank you.
I was just about to start your presentation, so could you kindly take over from here?
Great. Thanks, Phyllis, and welcome everyone. And thanks, Phyllis, for that introduction. I'll talk to you a little bit about the genesis of the digital learning series that we had last year from June through November, actually. It was called the Mutual Learning series, and it really was a collection of digital consultations that kind of examined the role of how non-state actors, as well as the private sector and the government, were collaborating in response to COVID-19. And from this collaboration, what kind of lessons were evolving, as well as mechanisms of engagement that could be applied to both redesign and rebuild health systems for universal health coverage. So this was a collaborative partnership where we, as the private sector and health thematic working group, along with some of our representative institutions, got together and had a series of digital workshops. Next slide. So basically, what led to the workshops was the fact that COVID-19 was changing the health sector landscape and had exposed many fault lines in country health systems. There were also a range of providers in terms of ownership and relationship to government and regulatory systems. And there was a balance that needed to take place, both in terms of accountability and transparency, because of the diverse set of stakeholders that were all responding in different ways to a common pandemic, especially around health systems resilience. There was also a need to ensure access to an affordable mix of both preventive and curative services, and yet reduce the risk of dangerous or exploitative practices when dealing with the for-profit private sector. Yet there was very little clarity on the various mechanisms of engagement between the private sector and the state. And so we decided that this might be a great opportunity to kind of explore how those mechanisms of engagement were evolving, who were the kind of players and actors who were engaged in health systems response. And that really led to this mutual learning series, which in turn resulted in a platform of sorts, which I'll also talk to you about. So the short series of meetings, and many of you who are part of today's organized session would have seen some of the calls for it, but really the series explored a range of partnerships that non-state actors were engaging in response to COVID-19, and also to kind of improve the health systems capacity of mixed health systems. The first meeting focused on new partnership models that were evolving, health systems capacity and service delivery. The second focused on the governance of mixed health systems, where issues around accountability and transparency and regulation were talked about. The third meeting was a dialogue with parliamentarians and in partnership with the Global Parliamentary Alliance on future health systems and shaping new partnerships. What were parliamentarians doing in response to COVID-19, and how were they engaging non-state actors, or were they engaging them at all? The fourth meeting looked at the role of evidence in engaging public and private sector stakeholders. Fifth one was done in partnership with the FCAS TWG and looked at the landscape of health service delivery in fragile and conflict-affected settings. And the sixth meeting, held in November, was around primary healthcare partnerships, and this involved countries like Singapore, South Africa, that really looked at where and how non-state actors were engaging in the primary health space, and how these partnerships were evolving. So the general objective of the series was to generate fresh ideas on how private sector service delivery and access can engage research as well as researchers, partner more effectively with government, as well as public health mechanisms across populations. And the outcome that we were really seeking was to create a kind of collaborative platform, network, or body of shared value creation, which could be generated either through evidence and opportunity between non-state actors, for-profit as well as not-for-profit private sector, government, as well as researchers, jointly be able to help identify health priorities for both interventions and engagement to strengthen country health systems. Next slide, please. Phyllis, next slide. So we had, in the course of these 6 meetings, over 250 participants from a very diverse background. So they came from different areas of the private sector, they came from governments, and they came from civil society. There were representations from multilaterals, policymakers, there were funders, as well as a large part of the research community. Next slide. So as you can see here, we had a huge range representation of the private sector. These included digital technology companies, pharmaceutical companies, diagnostic companies, as well as different types of government representations who are all engaging with different aspects of the private sector and different types of private sector in response to COVID-19. In the course of our meetings, we also, launched a survey to some of our audience members on what they felt, what were their opinions on engaging with non-state actors across various capacity. And there was a large percentage, next slide please, of our audience who felt that research could play a very integral part in, as well as a catalyzing role in engaging non-state actors as well as innovations in building mixed health system performance, and that there was a need, think about, next slide please, new types of partnerships with non-state actors that go beyond traditional public-private partnership models. So I think overall there was a consensus among audience members as well that research could actually play new types of roles in engaging with the private sector, and there was a better need to understand what new evolving partnerships were occurring among the private sector actors, to gauge their own role as well as responsibility in building health systems capacity in an accountable as well as a transparent manner. Next slide, please. So what were some of the key findings from the June through November discussions, which were all part of this digital learning series? So some of the key areas that were touched upon, where one was change and experimentation. One of the key things that came out of the meetings was that the disruption brought about by COVID-19 had really reduced the resistance by public and private sectors to experimentation and taking risks. So governments were really willing to try very new things without necessarily being certain of the outcome. And digital solutions and innovations in medical devices, treatment technologies, and supply chain, as well as diagnostics, have been made more possible with the usual barriers of innovation that have been relaxed. So that was one of the key things that kind of emerged. The second was, of course, the role of innovation itself, where digital technologies have especially demonstrated their potential to leapfrog health systems fault lines. And as a result, interoperability, the role of social media, data sharing with the government played very important roles in defining digital actors in response to COVID-19. In fact, it also raised a big question of whether we could balance the desire for digital health technology against regulation and privacy concerns. AI also played a very big role. In fact, some of the early cases in Wuhan, I think the first 8 cases were recognized through an AI-based algorithm in the very early stages of the COVID-19 pandemic. The third area was governance and leadership. And regulatory, one of the areas that were highlighted in the discussion was that regulatory reform had actually lagged behind both the proliferation and diversity of the private sector. And there was really an urgent need to establish appropriate regulations as well as build capacity to manage effective partnership. Scaling of pilots was another area. So a need to move beyond prototypes and pilots was recognized, and there was a need to focus on ways to take innovative approaches to scale by strengthening collaboration between both public as well as private actors. And here there was a question of accountability and trust. So the lack of effective oversight frameworks also poses risks both public as well as the private sector performance. Here, one area that really came up was that intermediary organizations with a public purpose mission could play a very important role to test new approaches and also generate trust and evidence of what works and what doesn't between non-state actors and the state. And finally, there was the need for enabling legislation. Appropriate laws were needed to encourage innovation, but also discourage dangerous and exploitative practices. And that was another area that was really brought up across the discussions. But at the end of it, a key area that emerged was the role of research and the role that researchers could play a very objective role in engaging stakeholders and shaping ways in which many of these sectors could work with one another. And there was an urgent need for rapid learning around these partnerships about what works and how. So strategies for making rapid progress towards UHC, especially in the future of mixed health systems, really needed to use all contributors to that health system. Next slide. Next slide, please. So some of the outputs of the mutual learning series included publications that are upcoming at the WHO Bulletin and other journals. There was an abstract that has been recently submitted to the T20 Forum on Digital Innovations. There is a report of consolidated findings on the mutual learning platform for engaging mixed health systems that will be available shortly, as well as presenting some of our findings here at this forum at the HSR 2021 forum now in January. In addition to this, we have continued partnerships with the Global Parliamentary Alliance on sharing evidence. There are partnerships on around the mutual learning platform that we are sharing with WHO, and as well as continuing some of our work on primary health care as well as maternal and child health, especially in relation to dealing with non-state actors that are happening across many of our own research networks within this group. But the most important outcome that we thought would be very key to share with members of this group was a platform. And that was this mutual learning platform for evidence and engagement on mixed health systems. Next slide, Phyllis. Thanks. So a key thing that resonated across many of the diverse stakeholders who engaged in these digital series was really the need or the lack of a platform that could bring together the research community, the private sector, both for and not for profit, as well as government actors to really talk about how evidence could really contribute to better engaging health markets. So companies sought ways to work more closely with the government and acknowledge the importance of research evidence in both building trust as well as transparency. Governments wanted evidence on what worked well and what doesn't in terms of public-private partnerships, and especially partnerships going to scale. How do governments deal with smaller companies that are more locally bred versus large transnationals who have a better propensity to scale? Regulators were really looking at new approaches to influence providers and as well identify bad or unethical practices. And both governments as well as technology innovators asked for studies that identified ways of integrating new approaches at scale. So for example, one of the things that COVID brought about was telemedicine. And there were a lot of new innovations around telemedicine. Now, is telemedicine going to work in a post-COVID world? How does one regulate for it? And so that was some of the questions that were asked. So the mutual learning platform essentially had a couple of objectives. One was a convening objective where researchers and diverse stakeholders could be brought together. The second objective was to generate research evidence that could contribute to better understanding how these new partnerships were evolving in mixed systems. And the third was the creation of intervention-driven partnerships that could actually contribute interventions at scale in both local as well as national settings. It would connect researchers to the private sector. It would create and synthesize and disseminate evidence, and also contribute to the larger global efforts to strengthening mixed health systems capacity. Next. Next slide, please. So finally, what are the implications of some of these learnings for future research on the private sector? And Phyllis will talk to you a little bit more based on the survey. But some of the new research directions that view public as well as private sector as integral components of mixed health systems would involve new partnerships between researchers, governments, regulators, and citizens groups. And there is a need to create new types and new kinds of evidence on existing partnerships and mechanisms of engagement. There is a need to bring skilled researchers as well as research organizations to public and private sectors to monitor, evaluate, and document joint intervention. And a lot of that monitoring and documentation needs to be both rapid, that is, response to health systems shock, as well as real time. There is a need to use adaptive and collaborative learning methodologies along with evidence from implementation to identify often pressing and difficult questions around working and engaging with the private sector. There was a need identified to connect data as well as knowledge, to support governments at national as well as state levels in making better informed decisions regarding the private sector, and more efficient and effective ways to improve health systems performance. There was a need identified to support intervention-driven partnerships between researchers and the private and public sector partners at multiple levels, and the need to experiment with new approaches, whether they are digital technologies, new models of care, and being able to assess some of those strategies for taking them to scale. And finally, there was a huge lacunae for research evidence to generate intelligence as well as insights to help stakeholders better understand health markets. So whether they are foresight studies as well as simulations, but there was a huge need for rapid research that enables government as well as the private sector to both anticipate the future and support the preparedness and resilience of health systems. So these are some of the broad takeaways that came away from our series. You can read and learn more about them from our website, www.innovation.foruhc.com, where we are documenting some of this, as well as have some of our meetings themselves that are now on YouTube and are also now embedded on our website. So I'd encourage you to take a look. And I'd like to hand over the meeting to my colleague, Jerry, who will talk a little bit about what the priorities are, what are some of the key research questions we could collectively ask, and then eventually open the floor to all of you all. Thank you.
Okay, thank you, Priya. Thank you for being just on time. We had lost you a bit. Okay, so we will proceed now with the survey that we conducted in relation to priority research questions around working with the private sector for universal health coverage. So the respondents to this survey were people on the mailing list of the Private Sector in Health Thematic Working Group. And between March and April 2020, we sent a few rounds of the survey, 4 or 5 rounds with reminders. And the mailing list is really global. We received responses from 30 members of our Private Sector in Health Thematic Working Group. These were the responses were from researchers, implementers, the private sector, and other colleagues. And in total, about 200 research questions, areas, or ideas were submitted. And we analyzed these results to produce thematic research areas and draft research questions. The survey really just had 3 open-ended questions, which are listed on this slide, and we allowed a free text and people could write as much as they liked. The first question was which private sector groups are most important for universal health coverage? And secondly, list 5 or more priority research questions around working with the private sector for universal health coverage. And this second question is where I'll focus the next few slides that are providing the thematic research areas. And finally, the third question was, how do you propose, the respondent propose, that our private sector thematic working group works more with stakeholders towards universal health coverage, and additionally, what research should we undertake? So now I will talk through the thematic areas, which we condensed to 8 thematic areas. So in this slide, the first thematic area was on around utilization of data from the private health sector. Now, a lot of data is produced in the private sector. My battery. Okay. A lot of data is produced, is utilized within the private sector, but does not necessarily or doesn't often get into the health management information system, perhaps, but also learning and activities within the private sector could be better utilized or shared outside itself. So the sample research questions that came up from within this theme are specifically around barriers to utilization of data. So what are the barriers to utilization of data that is produced by the private health sector? And why are researchers not using data from the private sector, including big pharma, to answer specific questions around universal health coverage? So that's an area where there could be more done in terms of partnership and linkages, and more research and answers there. But the second thematic area is around approaches for private health sector development, as in the entire what we want with universal health coverage is that everybody, even the poor and most remote, really have access to healthcare when they need it and for an appropriate healthcare. So what approaches exist for private health sector development? How widely are these used? For example, the approaches related to making markets work better for the poor. How can these learnings really be taken across the board? But also within a private health sector development work, what is the role of international aid, philanthropies, and I added religious organizations towards achieving universal health coverage. The third thematic area is on learning between countries on successful private health sector engagement approaches. How can learning be taken laterally or vertically all around, so that approaches that are being utilized in one country could actually be also utilized in another. For example, in terms of sample research questions, why do some countries incorporate the for-profit sector better than others? And then how can this learning be shared? The next thematic area is around reducing out-of-pocket expenditure for health and catastrophic health expenditure. I mean, this is key in universal health coverage. And so specifically for low-income countries, issues around national revenue and taxation for universal health care or for universal health coverage. How feasible is this? How sustainable is this really in low-income settings? And in attempting to reach the last mile, how effective are these our community health insurance schemes? So those two questions really encompass more of what are within the other questions. How can governments ensure inclusive and universal mechanisms to protect against catastrophic health expenditure? What is the role of health insurance contracting with for-profit providers in low-income settings for health insurance? What about not-for-profit insurance companies? What is their role in ensuring financial protection? And the big question really also, how can financing for primary health care in low and middle income countries be accelerated? So this is a big area, a lot of questions, a lot of interest, and that is crucial for universal health coverage. The next two thematic areas are common. The challenges around regulation of the private health sector generally and specifically for effective universal health coverage. What do we know about the effective strategies? And how can these be effective strategies for regulation of the private health sector? How can we improve this? A question on what could replace regulatory measures in fragile states where governments cannot conduct the public oversight. What could replace this? What approaches are used better for regulation there in fragile states? What about regulation of the for-profit hospitals? How can this be improved? And then issues around promoting public-private dialogue and optimizing the public-private mix in poor countries. The next area is on quality of care, which is also a big thematic area, but specifically two questions could encompass this. What is the quality of care and how can this be improved? But also what incentives for private providers would ensure delivery of quality health services. The seventh thematic area is on the informal health sector, which also provides a substantial amount of healthcare provision. But really, what is its true size in terms of volume and services provided, and what is and also in the same line, its contribution, the contribution of the informal sector towards. I think so. My screen is a bit blocked, but towards financial protection. And how to harness eventually this informal sector, small businesses, but also more the smaller formal sector, how to harness local businesses to create sustainable, equitable, and quality health systems in poor settings. Finally, a thematic area on review of lessons learned from fragile states. What can we learn from fragile states? Where private sector or private providers displace the weak government services, creating alternative governance, financing, and service provision systems, and how useful and effective are these almost parallel systems in fragile states. So those are the thematic areas around utilization of data, around I just go back, utilization approaches to private sector development, learning between countries, reducing out-of-pocket expenditure, regulation of private sector for effective UHC, quality of care, the informal sector, and fragile states. So the next steps with this research agenda are that these thematic areas will be further prioritized and the research questions finalized with participation of a bigger group of experts and participants within the TWG and outside. And we propose that over 2021, our TWG will take a work stream with its members to review the literature around these thematic areas, summarize evidence for publication, but particularly for sharing with the stakeholders, And for this stream of work, we would invite volunteers to participate, and also specifically people already working in thematic areas to join us, and we can provide the evidence and guidance around these priority thematic areas. And then around the private sector engagement platform, all our activities at the TWG, both before and within and in 2020, have led us to a conviction that more coordinated action between our private sector stakeholders, government, and researchers will contribute to better health outcomes. And Priya's talked about consultations we've had, and the outcomes of these really pointing towards the development of a platform for engagement of multiple stakeholders in the private sector in health. And so we will also continue as a separate work stream towards developing and really strengthening this private sector engagement platform over the next years. So at this point, I would like to invite comments from discussants and members of our thematic working group and of our actually coordinating committee to comment for a few minutes, just 3 minutes. This is the starting of the discussion session. Commenter Uranchimig, you're welcome. Kindly introduce yourself for less than a minute and give your comment in 3 minutes. You would like to comment on financial protection and health insurance schemes, that is welcome. And after Uranchimig, we'll have Gerald Bloom and finally Bertil Forsberg to make short 3-minute comments. Uranchimig, I welcome you now if you are here. Okay, she is actually not here. Gerald Bloom.
Sure, thanks.
Fantastic. Please introduce yourself briefly.
Okay, okay. I'm Jerry Bloom. I'm based at the Institute of Development Studies in the UK, where we are currently all locked down in our own homes. I guess I wanted to start with a big agenda has been presented. And last year, the WHO issued a document calling on governments to mobilize both public and private providers to address the pandemic and contribute progress towards UHC. And it's worth keeping in mind that in many countries, in many guises, the private sector is up to half or more of the entire health sector. So this is a very big agenda. And there are no blueprints for managing a mixed health system. And as researchers, we're all very aware of the problems that can arise in a poorly governed health market in terms of costs, in terms of lack of coherence, in terms of quality. So the issue I think that's facing governments and others is how do we get the benefits of engaging with the private sector while minimizing the risks of things going wrong? And I guess the question I wanted to raise is, what does this mean for health researchers? What does this mean for the roles and responsibilities of health system researchers? And I wanted to quote Dr. Gatahi, who's the CEO of AMREF and participated in some of the consultations. And he basically said researchers should be enablers of improvements in the performance of mixed health systems. And that really contrasts with a lot of what we've been doing in the past, which is observers, either looking at pilots and saying they worked well or badly, or as critics of the private sector. And it's a shift from that observer to being an active participant in the process of health system change. And that means, as we've heard, working with government, working with the private sector, working with citizen groups as partners in the effort to meet health needs. So quite a big shift, actually, in what we mean by researcher. This requires, obviously, new agreements by all participants to work together in a learning approach to development of effective health systems. And a key issue that's already been mentioned is access to data. And I wanted to mention this particularly because it's clear that a lot of, particularly the internet platforms, are investing massively more in health-related research than all of the investment by our research community on health systems research. And yet we have no access to the data they're collecting, and we're not really collaborating to say, what does this mean for the health system? So I think we have to recognizing that we are only part of a very big research effort around improving health systems, and we need to have a more effective strategy for participating. But of course, this brings to the fore issues of the values of research. And I just mentioned a couple, but it'd be good to hear other thoughts. The objective use of data rather than use for commercial purposes. Commitment to transparency and publication and peer review. And a commitment to the objectives of achieving a safe, effective, and just health system, which clearly is going to affect how we engage with these different partners. I think that's all I want to say, except the role of health system researchers as active participants rather than observers or critics in change process is likely to become increasingly important in a context of rapid change, including technological change, but also social and political change, and also the ongoing need to adapt to shocks. And I'm sure that the one we're experiencing now is only one of a series we'll have to adapt to. So I think this is a real change in a role, and I guess I would encourage people to comment on this, but more importantly, to come to the business meeting that we will be announcing a bit later, where we can really talk about how over the next couple of years we can work out what does this new role of a health researcher really mean in practice when we're dealing with a complex mixed health system in change. Thanks, and I will pass on now to Birger.
Hello, everybody. Hi, I'm Bertil Forsberg, and I'm a researcher and teacher at the Karolinska Institute. And my perspective on this really started in the 80s. I worked with WHO in the diarrheal diseases control program, which was also working together with the immunization program. And then the perspective was really, how do we get out the messages to the clients, the patients? We were working with children, so evidently it meant caretakers. And how do they get the stuff that we want them to get? And for diarrheal diseases in those days, it was oral rehydration solutions, and then later zinc was added to that, and so on. And so the perspective was the individual in the village or in the urban areas and so on. And then it became very clear to me, working in many countries from Geneva, that the major source of provision of supply was the private sector. And then later in the 90s, at the end of the 90s, I met Peter Berman, and then I said, we need to document that. There wasn't really much data, objective data, on the fact that most people in low-income countries and middle-income countries also for that matter, they rely on the private sector. So we had to find out about what they did and where they were and so on. And Peter Berman had already started on that work with Karen Hansen. So we developed this research project, and also others started to do this type of like pretty much enumeration work, just mapping out what there is and what they did. So, that was an evidence of the role that research can play. I think that all those research groups that came in, Rockefeller Foundation gave a lot of support also to this work, but eventually made everybody come together and say, all right, now we know the facts largely of the role of the private sector, how large it is. We started to get ideas of different types of working with the private sector, such as social franchising with Dominic Montagu's work, and contracting out. I worked with that for the World Bank in India and so on. So the message here is, yes, research can contribute a lot. And I think what we have seen after this era of mapping, et cetera, is that we have focused more on what is actually happening in the field. And that's, for instance, Catherine Goodman, whom I saw is also listening here. She did a significant work together with her colleagues on trying to understand how do you actually make the providers, the private providers, get into your program and assist you with whatever you want to get out to the people, impregnated bed nets or or rehydration or so and so on. So that's a perspective I would like to bring in here, that we need to see it from the perspective of the end user. What are the sources of information? What are the sources of supply? And that's not a stable sort of research object. Of course, it's something that changes all the time. And you've all seen the developments coming in many countries, with the private sector growing in the urban areas where the wealthy or where the incomes are improving, and then gradually also starting to develop in smaller towns and so on. So we need to have a constant focus on that, and then find ways of stimulating with the private sector to contribute to universal health care without getting into unethical support of low quality care or supporting general profit generation without any sort of commitment from those that we are working with. So those are some of the challenges, but I think research will definitely be able to continue to contribute a lot. And I'm very happy to see 20 years after I started that project on private sector, to see the enormous, I would say, development that has taken place in research around this issue. Jerry, you've done a lot also, plus many others. So thank you. That's my contribution. And the end, I want to repeat that we have a business meeting on January 27th, which we hope many will participate in, to really try to get these general talks we have now into concrete proposals. Thank you.
Thank you, Birger. Desta, I'm going to invite you if you are, if you would like to make a comment for 3 minutes. But as Desta prepares, because probably didn't prepare fully, I didn't alert you earlier. For the audience, I'd like you to use the discussion forum to please tell us who you are, the people that are in this meeting this afternoon or today. Please just write who you are and your affiliation or the work that you're doing, so that we can know who's here. And please type in your questions, because we are moving into the discussion section where we have almost 15 minutes to really interact with you in the audience. And so just write a question, and we will answer it. We will pull on to other members of the panel to comment or respond to your questions. Desta, are you available to give a comment? And Mustafa Hunter, Mustafa, if you are following closely.
Yeah, sure.
Okay, so Desta, you are there. Go ahead, please.
I'm happy to comment. Thank you very much for sharing this, actually, Phyllis and our team. I think the thematic working group has done a significant amount of work this year, and actually our mutual learning series began a couple of years ago, 2 years ago, not necessarily just during COVID. So we had already had some traction in sort of understanding the role of partnerships, the role of private sector in mixed health systems. So when COVID came, we had already really begun to think about and discuss what type of research was needed to support these type of unique partnerships, innovative partnerships. So in my view, I think the learnings that we have taken from this series is really that, you know, research can't take a back seat, and we really must push the research agenda, because there are so many private sector partners and other stakeholders. So as you heard Priya mentioned, you know, we had government, parliamentarians, private sector, civil society organizations, NGOs, all participating in this discussion. And at the end of the day, I think what it really leads us to believe is that we need a more focused research agenda to just support some of the things that we have seen happening. And these things are happening very rapidly, often without consistent data behind it. So when we look at, for example, the role that digital innovation or digital technology has played, there's a lot of information and sort of a gap in research in terms of data, who owns it, as Jerry said, etc. But I think most importantly, in my view, the type of dialogue series, mutual dialogue series, has focused on the Global South. And in the Global South, we see really a big gap in terms of research and publishing. So I think as a broader research community, HSG really needs to look at what type of research is needed in the Global South. How can that research be supported? How do we collaborate, you know, in the Global and South and North? How do we collaborate to ensure that the right type of research is done, that we are supporting some of the things that are happening on the ground, that are happening so rapidly, that we do need the resources and the information to back the kind of work we're doing. And in fact, to also prove that the type of partnerships, you know, innovative partnerships are really working well and can be supported by data. So, you know, that's my view, Phyllis. I really think what it reveals is the need for, you know, focused, supported research in the Global South. We talked about a mutual learning platform, and I suppose that, you know, will evolve as we continue our discussion and the work that we're doing in the thematic working group. But I feel very optimistic that we have a significant amount of contribution to make. And I just have to say, as a disclaimer, unlike many of my colleagues in the thematic working group, I am not a researcher. My role is really to lead global partnerships for AMREF. So it's very much focused on the interaction between different players in the government sector, in the private sector, supported by, of course, foundations, with other NGO partners. So my role is very different, and I think looking in from outside, what I see is a tremendous opportunity to grow the research agenda in the Global South. And I think that pretty much sums up what I have to say. So thank you, Phyllis, for giving me an opportunity to make comment.
Fantastic, thank you. And definitely your role is complementary to everything, all the other roles. So it's as important as ours. Mustafa, I give you an opportunity as well for a few minutes to make a comment. Please introduce yourself.
Okay, hi. You hear me?
Yes, we hear. I hear you.
Okay. Okay, perfect. So I'm Mustafa Hunter. I'm an expert, independent consultant for healthcare governance and private sector and corruption risk management. The way I see it is that what we've learned over the year of the mutual learning platform is that definitely it's not an observer seat, but rather also a change agent and sometimes leadership role, and sometimes also a brokering role. And where I see a research agenda, also I'm not a researcher, but rather a practitioner, I see the relevance to the stakeholder is of utmost importance, where I see research can help a lot in offering independence and objectivity in a very crucial topic that is always dragged by vested interests. So there is one, because private sector specifically, we need to leverage on the power of research on providing objective evidence and objective direction for different stakeholders, be it the government, civil society, or the private sector itself. And the other key point I see is knowledge capture of practice, because we've experienced that so many things are happening. The private sector, especially with COVID, the governments are interacting somehow, the private sector is interacting somehow, bits and pieces of stories that they become either story or anecdotal, that if they're consolidated and captured would help in shaping success stories, what worked and what didn't work, and offer guidance. And this would be, to me, also the key is to how have a dynamic relationship between the research community and different stakeholders, where it's a two-way path, and how the research agenda can be agile enough to interact with the very dynamic environment, which is the private sector, the health systems, and the COVID. So these are just like the key points that it's very important, it's very needed. There is a very strong competitive advantage for the research community. And the time is now to move into shaping this forward into a more consolidated direction. Thank you.
Thank you, Mustafa, for being able to make a comment, and thank you all of you on the panel today. I would like to move this forward into a bit of an open discussion to allow more feedback from the audience, and to guide this, the discussion a bit. But if not, you really can comment on any other part of the presentation as we've made it. But there's some guiding questions here which you could talk about. As I said, you kindly type into the discussion forum who you are and which area you're working in, and you could put it into the forum also. Are you interested in working with the TWG on any specific area or of evidence synthesis around research themes? And or you could just ask, what additional thematic areas or research questions would be important for us to cover or to deal with. As I said, going forward, we will finalize and strengthen the research questions so that really a research agenda can move forward in a more collaborative process. And then, but even before we do that, we would like that we continue within the thematic working group to utilize, to synthesize the evidence around key thematic areas. So over to all of you in the audience, write in your questions and let's take them up. I'm trying to get.
Felix, can you see the questions?
Please, you're welcome at this point, Birya, to help me. I have to use two different screens, and so I'm still looking for the questions.
We have some. I could reckon. Just read them out. Patricia Asikiwa asked, what did you do to reach hard? What did you do to study hard to reach areas?
Yes. So I saw that. And is there another question?
Yes, there are several questions.
Oh, there's several.
That's one.
All right.
Okay.
We studied hard to reach areas. We have not really done the research yet. This was a development of research questions. And understanding the key areas and thematic areas we should prioritize to understand and to really answer questions around. So yes, as you may have noticed, our key thematic area was around fragile states. Really what works there, where we know that private sector is actually perhaps often taking over public sector, provision of healthcare, just because there is no public sector that is strong enough. And this is the area where one of the thematic areas where we would like to collect the evidence around and really show what is working, what works, and even discuss how well or how useful approaches within the private sector could be in approaches within fragile states could be in non-fragile states, if they can be useful. Please go ahead with other questions.
Yes, Francis Wafula, he says lack of trust between the parties, I understand is a major barrier, and that includes trusting research outputs. So essentially the question, how do we ensure, I would say, good reception of our research so that it's considered objective and not biased? And there is another question which sort of relates to that. Somebody was in another seminar with big corporations influence were discussed. And the question is, how do you ensure that your research does not end up in the hands of big corporations? So I guess those two are somewhat related. Please.
Okay, it's because I'm seeing the questions very belatedly. How do we handle the egg? We need governments to allow.
Yeah, that's another one. Maybe Jerry would like to comment on this one.
Yes, if somebody. Yes, all the people on all the panelists who would like to please take up a question, go ahead. I welcome you. But as I also try to internalize the questions here.
How do we remain objective in a world of competition and lobbyism and big corporations and so on? It sounds like to me a real Jerry question.
Okay, Jerry, you've been picked on. I hope you're there. Please go ahead.
I'm here, but struggling to find the chat.
Yes,
but you know, I think you're asking a key question. I guess if you're totally reliant on a big corporation for the funding, and you just work with them, the chance of having autonomy is not very great. So I think the question you're really raising, as these companies become increasingly important, and we can see right now how the digital platforms are going to become very important, is that we need to find ways of working with government and citizens groups as well as private companies in solving particular health problems. And I think that's the only way we're going to preserve some autonomy. It really also depends on your institute and how much they can enable you to have autonomy. I think you're bringing up one of the big questions for the next few years for the research community, because up till now, we've kept ourselves away from the private sector, but that means that a lot of the action is taking place outside of our anything we're observing. But if we get more engaged, you're bringing up one of the key questions we'll have to deal with. No answer, but come to the business meeting to help us think through how to move forward in this context.
I could add, I think that if you always have as lead star that your research needs to be scientifically defendable and follow the norms and standards of science, then you can also work with different partners. And then also from the start, inform them that this is your lead star.
I would add on that, we can't work unless there's agreement that data and findings are published and peer reviewed.
Yeah, right. Okay, there was a, can I take another question, or Phyllis?
Yes, go ahead.
Yeah, okay. No, there is a good question saying that a lot of the research, maybe the one that I also mentioned, has been focusing on the poor, the small providers, etc. But there is a growing sector of commercial healthcare. Also, I also alluded to that. And what do we do to research that? This was Kea Melo Furtado. So.
Yeah, I can take that, Birger. Actually, you know, the question around a lot of initial, you know, there's been a lot of research focusing on informal providers, and this network was also invited to be part of our digital learning series. And it was really interesting to see, you know, that the non-state actors form such a diverse community. But, you know, your question also addresses that there needs to be a better understanding of what the formal private sector is doing. And we had a host of them who also participated in the digital learning workshop. So I think it's essential to really structure our questions around how these various networks are evolving. And I think there has to be a better understanding of the formal private sector, both in terms of the topicality that they represent, how they themselves are evolving, and also how they themselves look at what their own roles are going to be in mixed health systems going forward. So I think I'd reprise what Jerry and Birger were saying, that maybe going forward, part of some of the work that this group could be doing is to really address questions around the evolution of the formal private sector going forward, how COVID-19 is really changing the game, and also where and how informal providers will need to fill in some of those gaps left by formal providers, especially in areas where the larger formal private provider networks are still not representative. So one of the things that we noticed in COVID-19 in many emerging economies is that in rural areas and peri-urban areas where formal private networks were not half as strong, it was the informal providers who were filling in those gaps. And where larger for-profit providers were struggling to kind of get their act together, it was the digital innovators who started coming in and filling in those gaps. So this leapfrogging of technology, of scale, of providership is something that has really exposed a lot of new types of collaboration. And I think some of the work of this group would be to really. So I hope that kind of leaves some room to think about.
Okay, thanks, Priya. Thank you. I was losing you at some point, either my or your connection, but thanks for your comment. And we seem to have only 2 minutes left. Birya, just confirm, I see one question that is visible to me. Was it possible to collect topical areas for further research that may interest public and private sectors, or is this planned at a next stage?
That was George actually, but he withdrew his question because it was premature. I think he got an answer when the presentation was given.
Okay, thank you.
Thanks, George.
And is there something we didn't?
No, I think we covered what there was, more or less.
Okay, all right, fantastic.
I just can add something about these vested interest part, is that we should agree that the private sector would move us or without us. It's moving, it's evolving, and it's dynamic, and it will always be driven with vested interest. So denying that or avoiding engagement would not benefit neither the private sector nor the research community nor the patients. And finally, then to deal with it, we just need to discuss how we shield the objectivity by maybe splitting between the funding and the research, putting criteria, governance criteria, conflict of interest criteria, rather than avoiding it. So one discussion would be interesting as to how to create the models that protect the objectivity while engaging with these vested interests.
Okay, thank you. Thanks, Mustafa. All right, as we conclude, because we probably just have 1 minute, I'd like to thank you all for attending today. And we've taken all your feedback and thoughts. As we've said, we continue with developing and finalizing this research agenda, and actually beginning to work on thematic areas. And so we really welcome you to work more with us, all of you in the meeting room. On 27th, we will have a business meeting online at 12 p.m. UCT. We'll share that through but if you would like to participate and you're not part of the mailing list of the TWG, please write to us. Write it in the chat box right now. Put your email address. We'll get in touch with you. Join us so that we can really plan for the next 2 years and complete and continue our work in relation to our expertise and what we can contribute to universal health coverage through research. And you will also feed into the proposal that our thematic working group is planning to submit to the association for the next 2 years. And with that said, I'd really like to thank the panelists, and I thank all of you for attending this meeting. I thank you, the audience, and we look forward to further engagement and working together. Note the day and time, 27th January, a Zoom call at 12 p.m. UCT. So thank you all of you for coming, and we'll remain in touch. Goodbye.
Thank you, Phyllis. Well
Okay.
done. Thank you.
Bye,
Bye, everybody.
you.
Bye-bye.
Bye-bye.
Take care.
Bye-bye. Thank you.